Hello, good day and welcome to this channel. This is Clinic Wahala by yours truly, Dr. Catch. Alright, we will delve into the first topic that we have for this time and this period. Yes, I'm a medical doctor who has a bias for cardiovascular medicine. What does cardiovascular mean? Things that has to do with the heart and the blood vessels. So the commonest problem in this my area is what we are going to start with today. And it's not just common in my area, it's also very common worldwide. As a matter of fact, more than 40% of adults in the whole world, that's if you see your friends, if people are 10, 4 of you will likely have this condition. So it's that common. It's non-communicable, as you can't transfer it from one person to the other, but it's something that is everywhere and causing plenty problems. People have many theories about it, some good, some bad. Some have put people in serious tension and panic because of it. So that's what we're going to be treating today, and that's hypertension. Basic classification of hypertension, which says that you have the primary, or the one that just comes up. That's primary, it just comes up. That's the commonest one. Over 90% of people have this type of hypertension. It just comes up. And you have the secondary, the ones that something happening elsewhere is causing it. So the primary one, which is the one that occur most of the time, over 90% of hypertensives have this primary one. The cause is not known. It just comes up, and you need to monitor, you need to treat. You don't treat it completely most times. You just have to be on your drugs called antihypertensive drugs, anti-BP drugs. You have to be on them regularly and keep seeing your doctor so that he can coordinate and balance it well in a way to be best for you. So that's the one that is commonest, the primary one. The secondary one, caused by some other things at the background. Some people may have a background kidney problem that can cause hypertension. Some people will have a background problem in the throat, they call thyroid, that can cause hypertension. Yeah, some people could even have diabetes for over a long time. It can still bring forth hypertension through many ways. So those ones, if you can treat the thing causing it, then the hypertension will likely resolve completely. But majority, over 90%, it doesn't have a cause, so it just comes and is just there and keeps on going. You just need to be managing it and taking your drugs regularly to balance it. So hypertension, well, they will say it affects more of males than females. It can affect both sexes, yes, but the number of males are usually higher. Then as we age, as we grow old, the probability of having hypertension also increases. So that means you need to check your blood pressure. You need to check it regularly. As you're advancing in age, make it a point of duty to include that in your health check. You can quickly and easily do that when you get to a hospital. You can just tie that and check and tell you what it is so that you can act fast. Just like I said, hypertension may not be treatable, but it's very manageable. The drugs are everywhere. We have different kinds of drugs that can be used for hypertension and keep it low. And the truth is that if you keep it low and normal, you can live normally the rest of your life and there will be no problems, there will be no issues. That's the truth. So that's why we encourage, that's why we are doing this video, that's why we have this channel, so that we can bring to your knowledge that it's possible to be hypertensive, but you take your drugs and you're normal like every other person. You're normal like every other person. Live as long as you have to live. So it's a possibility, and that's why we are doing this. Yeah, that's part of the reason this channel was created. These are the things we share with patients one-on-one when they come in the hospital. But we felt there is a need to bring that information and keep in the public domain so that people can easily reach out to this video and learn these things and get this counsel, so that the aim is for us to be healthy. That's just the thing. That's the aim, for everybody to be healthy. So we are not hiding any resource. We are bringing it out to the public domain so that people will learn and be healthier. Okay, so back to our topic, hypertension. So hypertension, as common as it is, affecting so many adults, is something that we can manage. So first lie that I want to take out is that this essential or primary hypertension is treatable. Is completely curable. That is not true. At least from the books and the researches, it is not true. I have so many patients that have come down with stroke. The truth is that even as of today, I'm going to see somebody, if a relative who said has come down with stroke. Why? He is hypertensive. They told him he was hypertensive. In fact, that's the story of 90% of the patients I see. You are told you are hypertensive, they give you drugs, you take the drugs, the BP drop, and you stop because the BP have dropped, and you don't even check again. So once the drug clears from the system in 1, 2, 3 days, the BP starts coming up, you don't check, it just keeps going higher and higher and higher. Then when it gets to a point, it will now blow up something and you have a stroke. So that's the fate of so many patients, especially in this resource poor country where health seeking behavior is not wonderful because of finances. So it's one truth you need to learn, and that's part of the things you need to learn to help your treatment. You need to know that hypertension, especially this primary type of hypertension, is not completely curable. You need to manage it. You need to take your drugs regularly. You need to check the BP regularly so that you can know how to manage yourself and avoid high BP and even low BP. So it's important that we get to understand this and pass it on to people around us. Let them know that you need to be checking this out. This thing will not just go. You need to be checking it regularly so that you know when to act. And that means they also need to be seeing their doctors from time to time so that they can review them and review these drugs and know whether they are still supposed to be on these drugs or whether there should be a change based on things they find. That's another problem people have. They just know that I'm taking amlodipine, they'll go with it. It's only amlodipine they'll take, and it's only when they remember they'll take it. They think that's the way it works. It doesn't always work that way. At some point we need reassessment so that the best medications will be given to us. So that's an important thing you need to learn. That is something that is not completely treatable most times and for most types. So you need to follow up and be sure that you are checking it out so that you don't have the complications. I've already listed some of the complications that are common. Most people you see who have stroke is from hypertension that wasn't controlled. Most people you see who have heart failure, swollen up all over, is likely from hypertension that wasn't controlled. Most people who you see who have kidney failure, likely from hypertension that was not controlled. So it's important that we look at this hypertension. Then let's just try and do a little bit of description of what this hypertension is to the layman so that we all flow. It's not everybody that understands hypertension and the concept. Okay, at least if you break down the word hypertension, it has hyper and it has tension. So there is so much tension, hypertension. So how do I mean? Take a picture of or just try to reason and remember when back then or even currently when somebody puts a water pipe and connects it to a very powerful tap, and you turn on the tap, maybe not highest, to a given level halfway, and at the other end you are holding the hose, the pipe. You want to water a garden, you see the water coming out normal, spreading on the plants and the soil to water the whole area for growth. So imagine that the tap that is bringing out the water as the heart, while the pipe is the arteries and the veins. They call them blood vessels. Yes, that run through the body. It runs from the heart to every organ to supply every organ blood and the veins will collect the blood that has been used from those organs and supply it back to the heart, so that the heart will also take that blood, go and put plenty oxygen in it in the lungs, and take it to the whole body through all those arteries again. They are like wires, plenty wires, but they have pipes. They are like pipes with holes, so this blood will flow through all of them to these organs. So just picture it that way. So when the tap is maybe halfway and you're watering it, everything is going fine. So imagine what happens when somebody will go and maybe try to compress or press one portion of the tap. Pressure will start building. One portion of the pipe, pressure will start building up. So the force of the water coming out from the hose will increase. In fact, some people use it as a plaything to fight. When they connect a tap to a pipe to a high power tap, which is flowing so hard, they will now go and compress towards the end of the tap so that the water jet coming out will be hard. They can even shoot it at you so that you run, because it's a little bit painful, not like the one when you put the tap halfway and it's flowing normally. So there is now much tension in that pipe because you pressed it to generate a very harder jet of water. So most times if you press it hard and this jet is coming out, one thing that happens, if you remember back in the days, if you have been in the normal maybe villages or town where they do farming and all those tap and pipe, you remember that sometimes when you press on these pipes, on this tap, there is a backflow, there is a pressure that goes back. Most times it can even pull out the pipe from the tap. You now need to go and reconnect. If you remember that, if you think back when you were young, or if you did that in suburbs and all, the pressure goes back to remove that pipe from the tap. So you may now go and plug it back and use rubber or something or cloth to tie it hard, and now increase the force, increase the tap maybe to the maximum, so that there will be force, greater force coming out through the pipe, so you can push through that place you pressed and come out as a hard jet. So just picture this scenario. So I'm trying to use it to describe what happens in the heart and as it pumps blood to the arteries and all. The heart is the pump. When you are normal, it's pumping normal, generating blood normally. They are flowing smoothly through the arteries and going to meet everybody without that force, without that hard jet that can injure somebody. So when hypertension now sets in, it's as if somebody is compressing those pipes through which blood is flowing. Of course, it means that if you are compressing it, blood first of all will not reach all these organs it's supposed to supply. What does the heart do? Heart will have to increase its force of contraction and speed of contraction, so it can overcome the pressure that you are putting on this pipe. That pressure is hypertension. So the heart increasing is how the heart tries to cover for this hypertension. The heart tries to increase the force of pumping so that it can pump beyond those places that are compressed and still get to the tissues. Because if it doesn't supply blood to the tissue will die and there will be a big problem. So it must supply blood to the tissue by all means. So it does that by increasing the force at which the heart contracts. So yeah, and there are other things that also happen. Trying to maybe see whether it seems this pipe is now loose, so I need to tighten it up. So those things, the body gives itself those signals. They will now go and produce things that will even tighten the arteries even more. Their aim is to tighten it and see whether it can increase the jet of flow, so it will go and reach those organs, because the organs are already complaining because of hypertension that they're not receiving enough blood. So you need to get blood to them. So the heart is increasing its pumping. They are bringing hormones to go and press that pipe even more, so that the jet will be harder and go far. So this whole cycle is not good for the body, it's not good for the heart. So it ends up causing the heart to overwork itself. When the heart overworks itself, that's how what we call heart failure comes in. You see one big problem of hypertension when there is so much tension in that pipe and the heart is trying to pump against it. It pumps to an extent, it it keeps getting big. Some people have complained that they did x-ray and they say that they have a large heart. This may be a cause of it. If you take a young guy to like I said, a resource poor country where we see some young people who set out to go and do some menial jobs, carry heavy load. So when they carry heavy load, and do that for a while, what happens? Their muscles will start increasing. The young guy you saw initially, the muscles start growing up bigger and bigger and bigger. So when you see him in 6 months, very heavy muscles. Same thing happens to the heart. As it pumps and pumps and pumps and pumps, over time it increases in size by adding muscles to help in the pumping. So that's how the heart gets that big. Alright, so pause here. Remember to click the like button, also subscribe and share this resource with your friends and family. We'll continue from here. Have a nice time.